Welcome to Lifestyle Matters. I'm Marilyn Moore, and if you do not like the dentist, I found the perfect dentist for you, and I am not kidding you. We're at First Impression Dental with Dr. Lent, and we're going to hear all about his dentist office. We're going to take you around, and we're going to hear about the newest technology that he has here. Doctor, thanks for joining us.
Thanks for coming.
Why don't you tell us about your background a bit?
Well, I've been a dentist for 11 years. I went to UCLA, graduated in 2007. I grew up the son of a dentist, so I guess it kind of came natural. I really, from a young age, wanted to get involved with it, and Dad encouraged me to get in the office and do things. I was a dental assistant for years and years, and, well, I stuck it out, and I'm doing what I always wanted, so it's a great thing.
That seems to always happen. It follows in the family line.
To some extent, yeah. I got three brothers, and I was the only one, but it worked out well for me, so I'm enjoying it.
There we go. Well, you walk in here, and the first thing that caught my eye was this beautiful plant wall. So why don't you explain, what were you really going for with the atmosphere in here?
I wanted to be as comfortable as possible, so we went for an environment that felt as little like a dental office as possible. I haven't met too many people, myself included, that like going to the dentist. We like the results, we like the feel of clean, healthy teeth and mouths, but we don't like the process. So anywhere in the design process and experience process that we could make it more comfortable for our patients, we made those decisions along the way, from the way it feels to walk in, to the environment and the chairs, the looking out the windows even. We have a nice garden that you can look at, and we use the best technology to make things as painless as possible along the way and make sure that what work we do for our patients lasts as long as it possibly can, so that we keep your visits as few and far between as possible.
We all like to hear that. You mentioned technology, so I know we have this laser here, this amazing laser that I just want to mention a little bit about, and then I want to go see it.
Okay, great. Yeah, we're one of a very few at this point offices in the country to have what's called the Solea Laser. It's an amazing bit of technology. There's been dental lasers in out for years now, but none have really fit the bill. They haven't done what they proposed to do. This one works very differently than all the other ones, and it really allows us to do everything from fillings to soft tissue work, meaning cutting gum tissue, without anesthetic, believe it or not. So we can do fillings shot-free, no shot along the way, and it's really been a positive thing with our patients. Fear is one of those roadblocks along the way for most people, and almost always it's associated with this shot. So if we can remove that and make people's experience, again, more pleasant, why not?
Well, this sounds too good to be true. Let's go check it out. Okay, pain-free, blood-free. Tell us how this laser actually works.
It's a unique laser in that not to get too science nerdy on you, lasers all work by wavelength. And this focuses at a wavelength of 9.3 micrometers, which is exactly what is necessary to cut tooth. It's also pulsing the tooth at over 1,100 times per second, and that stimulates and causes an anesthetic-like effect to the tooth, thus removing the need to truly do a shot or anesthetic from the procedure. And it's truly remarkable. I didn't believe it at first, and tried it out in a demo, and was just blown away, because I tried other pre-existing ones and they simply didn't work. But this was a true game changer for our patients.
So walk me through the process. I come in here to get a cavity filled. How long am I in here? What is the whole process like?
So it's about the same as the traditional route. We always schedule, depending on size of the filling, how long it's going to take. But in some regards, it's faster in that we don't have to give the shot, wait for the shot to work. There's no post-op sensitivity based upon the location of an injection. So we forego a lot of other things and can simply have a conversation and start to work. The rest of the filling, the procedure itself in terms of putting a filling in, is the same thing. We use a composite resin material, we line everything, we bond it, seal it all up, and by the time you walk out, everything's ready to use. You can eat, drink, brush, floss, everything right away. And one of the best things for us is that Because you're not numb, you can immediately tell us how everything feels. So you know that the bite is right, rather than what happened frequently in the past is people would say, yeah, it feels great, and then the anesthetic would wear off and it wouldn't feel great. And they'd have to come back, get an adjustment, things like that along the way. So we know immediately that things have been done correctly for you.
Well, that did happen to me before. So this, I mean, I'm just mind blown hearing about this machine. And are you accepting new patients?
We're always accepting new patients. We're a brand new office and happy to serve the Fresno community.
Well, you just got a new patient right here after hearing all this stuff. We have been at First Impression Dental with Dr. Lent, and they are accepting new patients. And I'm not kidding you guys. The motif, the atmosphere, you walk in, it's clean, everything, all the technology is just amazing. So I'm going to be a new patient, and you should be a new patient too. Thanks for tuning in. I'm Marilyn Moore.